23-year-old male has 5 days of purulent urethral discharge and dysuria. He has suprapubic tenderness and mucopurulent urethral discharge. For the investigations, the urethral swab microscopy shows gram-negative Diplococcus, no sensitivities. Which is the most appropriate first-line antimicrobial therapy? A. IM ceftriaxone stat dose. B. Oral azithromycin. C. Oral doxycycline for 7 days. D. Oral erythromycin for 14 days. Or E. Penicillin V for 5 days. So I'm just going to give you 20 to 30 seconds to think about it. If you need longer, you're more than welcome to pause the webinar. So the answer to question C is A, IM ceftriaxone stat dose. And we're going to go through the slides to find out why that was the right answer. So gonorrhea is a gram-negative Diplococcus bacteria. It infects mucous membranes with a columnar epithelium, such as the endocervix in women, the urethra, the rectum, conjunctiva and pharynx. It spreads via contact with mucus secretions from infected areas. Gonorrhea is a sexually transmitted infection, so being young, sexually active and having multiple partners increases the risk of infection with gonorrhea.
Symptoms of gonorrhea, it's important to remember patients can often be asymptomatic, especially in females. Symptoms in males include frequency of urination and dysuria, testicular pain or swelling, also known as epididymitis, urethral discharge, including purulence or mucopurulence. Symptoms in females include dysuria, lower abdominal pain, abnormal vaginal bleeding, and vaginal discharge.
To diagnose gonorrhea, we use nucleic acid amplification testing or NAT testing. This is used to detect the RNA or DNA of gonorrhea. Genital infection can be diagnosed with endocervical, vulvovaginal or urethral swabs, or in males we can also use a first catch urine sample. Rectal and pharyngeal swabs are recommended in all men who have sex with men and in those with risk factors or symptoms in the infected areas. It's also important to remember a standard charcoal endocervical swab should be taken for microscopy, culture, and antibiotic sensitivities. This is particularly important in gonorrhea because of very high rates of antibiotic resistance. For management, this has been taken from the British Association of Sexual Health and HIV guidelines and NICE CKS. So patients with a positive swab should be referred to the gum clinic to coordinate testing, treatment and contact tracing. Management specifically for gonorrhea depends on whether antibiotic sensitivities are known. For uncomplicated gonococcal infections, a single dose of IM ceftriaxone 1 gram is used if the sensitivities are not known. If we do know the sensitivities, it's recommended a single dose of oral ciprofloxacin 500 milligrams is used. However, it's always important to consult the guidelines as different regimes are recommended for complicated infections, infections in other sites, and pregnant women. All patients with gonorrhea should have a follow-up test of cure, given the high rates of antibiotic resistance. This is with NAT testing if they are asymptomatic, or cultures where they are symptomatic. As always with sexually transmitted infections, other factors to recommend to our patients is abstinence from sex until treatment, to provide information about ways to prevent future infections, and always consider safeguarding issues and sexual abuse in children and young people. So for gonorrhea, there is numerous complications we need to think about. High yield examples include pelvic inflammatory disease and chronic pelvic pain, infertility, epididymoorchitis and prostatitis in men, conjunctivitis. There is also disseminated gonococcal infection, also known as GDI. This is a complication of untreated gonococcal infection where the bacteria spreads to the skin and joints. It causes non-specific skin lesions, joint aches and pains, arthritis, and systemic symptoms such as fever and fatigue. A key complication to remember, which is again very high yield, is gonococcal conjunctivitis in a neonate. Gonococcal infection is contracted from the mother during birth, and neonatal conjunctivitis is called ophthalmia neonatorium. This is a medical emergency and is associated with sepsis, perforation of the eye, and can cause blindness in the neonate.